I now have the distinct honor of inviting our last conversation for today, two of LA County's incredible health leaders. And so with that, you've heard from some incredible folks. You heard from a lot of folks from an arts-led, we might say, perspective. Well, now we're going to hear from Dr. Barbara Ferrer, which is the county's Director of Public Health, and Dr. Christina Ghaly, our Director of Health Services, joining us today. Please come on up. All right, so I have to just start. I mean, there's a lot of things that I would like, everybody would love for us to hear from and pick your brain, and maybe we'll have a little bit of time for questions from the audience. But I have to just start by genuinely saying and thanking you for the roles that you play. I mean, nobody could have imagined we'd have a pandemic. And I'm not sure even if folks know the scale of kind of your responsibilities. Thank you for your leadership in public health and in our hospitals. And it's been stunning just to watch and just to be a part of it. And so we're just thankful that you're even here today. With that, folks sometimes say that art and artists are like second responders, thinking about sort of folks' emotional well-being or engagement, but you're really on the front lines. And so just our first thing is just a little bit about, can you just share a little bit about who you are, what you do, and just broadly, like, how are you feeling in this moment? And then we'll get into a few of our prepared questions.
Sure, and good morning. I'm so honored to be here. Thank you, Kristin, for inviting us. Thanks to LA Opera for hosting us. And most importantly, thanks to all of you for being here. I do think it's a really important conversation. I'm Barbara Ferrer. I've been working in public health for a long time. I also was a high school principal for a while. And I started my professional work really as a community organizer. It's not really professional work necessarily, but my work. And spent years as a community organizer. And I'm excited to be here because I always think of the arts as the place where people really give voice to healing and justice. And I think if you're in public health, you're getting involved in both as well. So for me, that's how they're connected is, many of you are artists, and I'm obviously not at all. But I do think that for those of us who experience the magnificent works you allow us to experience, it is a way for us to also heal, as much as it might be healing strategies for those people that are engaging in the arts. But I think also importantly, for me, the arts have always been about giving voice. And I don't mean voice like verbal voice. So it could be visual voice, it could be, voice might not be the right word, Kristin. You could tell me what the right word is.
No, I love it.
But it does allow for stories to be told in many different ways that will resonate with many different people that really are about, for me, justice, about being able to have us all witness and experience the richness of what both ties us together, binds us together, but also what allows us to work together towards a more just society. So that's sort of where I've always been. I don't know if it's right or wrong, because we haven't had a chance to ever really talk about how we at the Department of Public Health are connecting the work. But Kristin knows we were so excited when she came here because she really embraced the idea that we could do work together, and that there was a place in the work in the world of public health for us to be both friendly to artists, but also more importantly, to allow people that we serve, which is the whole county, to experience the opportunities that are inherent in being part of creating and participating in artistic endeavors. So I'll stop. I'll turn over to Christina, Dr. Ghaly.
Thank you. Thank you, Kristin. Thank you, everyone, for being here, and to the LA Opera for hosting. I spend a lot of time on Zoom, so I'm very happy to be in front of living and breathing people in person. I'm the director of the Department of Health Services for Los Angeles County. We do 5 main things. Just as quick background, if you're not familiar with DHS, we run the county's 4 public hospitals and 26 clinics. And then we run health services in the LA County Jail and Juvenile Court System. We operate the Emergency Medical Services Agency. We run the Housing for Health Division, which does a lot of street outreach and interim and permanent supportive housing for the county. And then we operate the Office of Diversion and Reentry. So I was interested. I came in at the tail end of the last panel and was so eager to hear some of the comments about justice reform. I am also not an artist. I did, though, I feel like I flirted around with it a little bit. I actually started college as an architecture major. The only thing I ever wanted to do my entire life was be an architect. I spent, from the time I was a little kid, drawing houses. I used to love to go into space. I still love beautiful buildings like this one. And I started a major in architecture. Very long story, which I won't bore you with today, but ended up changing my major and going to medical school and went down that path. But I think for a long time when I thought of the arts, especially as it overlapped with health, I thought about it mainly in the sense of physical space. And I am a big believer that physical space matters and that physical space can be an enabler of good healing relationships, that it is important in both showing the respect and dignity of the clients that are served and of communicating the importance of value of people. But it's so much more than that. And I think really partly as a result of the pandemic and also just DHS's own evolution over the past couple of years, we've come to see, I think, the different ways in which the arts affect and can help supplement our work so much more deeply than only in physical space, though still physical space is important. You mentioned engagement, healing, and we can talk more about that, but so much of what we're trying to do within DHS and all of our different programs is do a better job at engaging with the community and engaging with our patients and engaging with their families and engaging with our staff. And the arts is one very valuable way in which we can do that. And I think that there's infinite possibilities to be able to leverage the strengths of artists and people who have skills in the arts to be able to help us do that better. So to me, it's this really untapped frontier that I am excited to see where we could go from here. But thank you for letting me be part of the panel today, and it's nice to see you all.
So I'm going to pick up on something you were just speaking to. You both have acknowledged, and we've all acknowledged, which is the pandemic. We've heard some folks talk about the pandemic as the great reveal, in that it actually magnified a lot of issues that were already here. And so I just wonder now, and I hate to say we're in year 3, but in this moment, in really our 3rd year of this moment, looking at it, are there things that you're really thinking about that we didn't see before? Has your even definition of health changed? Where are you right now, just in terms of your state of thinking about things because of the pandemic?
I think it's a tough question. You know, in many ways, the pandemic, I think certainly for us, put in front of everyone's face the harsh realities, the ugly reality of what's been going on for decades across this country and really across many parts of the world, which is the racism, the marginalization, the disinvestment in both communities of color, Black and brown communities, indigenous communities, and in communities where there are high rates of poverty. You can't escape it. For many people, I think you could go through your days and years and decades prior to the pandemic without ever thinking for a minute about disproportionality in health outcomes. And I think it's really virtually impossible for anybody who's been aware and actively participating in sort of civil society to look at what just happened and not have a much deeper understanding about how much work we have to do as a country to address the root causes that have really exacerbated the inequities that we have seen for decades in people's well-being. So, and it's beyond health. I mean, it's absolutely that broader concept of well-being. You cannot be blind to the fact that Black and brown residents in our lower income communities, even if they're vaccinated, and I want to say that loud and clear so people sort of put aside the mental image we have of people who are at poorer health than others as somehow having done something deficient. Fully vaccinated Black and brown residents, fully vaccinated people living in communities with high rates of poverty have much higher case rates, hospitalization rates, and death rates than fully vaccinated white people and Asian people. And that's racism, that's discrimination, that's a history of disinvestment. That's the fact that many people who were lower wage workers in particular, they have never gone home for a minute during the last 3 years. And for those people who are on the front lines, be it at a factory, at a grocery store, at a healthcare facility as a custodian, those folks have more exposures than the people who stayed home when we said, please stay home, and were able to telework. And there's no getting away from the reality that the conditions in which you live and work have a lot to say about your health status. So the conditions in which people were working and still are working really make it pretty easy in many places for there to be a lot of transmission. And then people go back to high-dense communities and overcrowded housing, making spread that much easier. So before everybody runs to blaming the very people who are having the worst outcomes, I think it's important to understand our health outcomes are largely determined by where we're working and living. And that's what this pandemic made very clear to anybody who didn't want to keep their eyes closed and doesn't want to be in denial.
Thank you.
I think the hardest part of your question, though, is what does it mean? Because if you're working in public health, this is not new. Like for us, inequities in health outcomes has been a long-standing issue. And the question is, are we at a pivotal moment where we actually are able to make the changes? And what have we learned throughout the pandemic that would allow us to make the changes? And, I'm an organizer by training, so, it's organizing. We've only gotten through this pandemic because of all the partnerships. And people sort of look at the public health department, oh, you guys did great. No, we didn't do anything by ourselves. We had huge partnerships with, not just with organizations, faith-based organizations, community organizations, healthcare institutions that were amazing, but with individual people who sacrificed and stood up for what was right and for doing what was right. And we have to somehow figure out how we're going to use this, what I call this sort of new reality for all of us, to actually continue to work that's most essential on addressing those root causes of the inequities we see. But I just wanted to throw that in because I think that's the hardest task.
Thank you so much for that. And I will just say you were one of the first health leaders I saw publicly to say and name racism is a public health issue. And I just, honestly, as much as it raises the stakes and it's so painful, but I was so proud and frankly just overjoyed that we have leaders like you and that we have a board of supervisors who wants to actually name it, who wants to move that forward, because it's critical for all of us, no matter where you enter the conversation, no matter whether you're an artist or a health person or a policymaker. And so thank you so much for sharing that. All right, so what other things do we want to name that have been revealed or magnified in the pandemic?
I won't elaborate further on what Dr. Ferrer already so eloquently covered. I fully agree with everything she just said. The only small point I'll make on that and then cover just a couple of other quick things that came to mind is that if you go back and you read the literature 20 years, 30 years, it's all there. It's all there that health outcomes are race-based. It's all there that there's disproportionality. It's all there that social determinants of health matter, that built environment matters, that where you were born, where you live, what your wealth status is matters in terms of your health outcomes. But I don't think that it became real for people and so prominent in our conversations and in our discussions and in our public discussions until COVID really, in very stark reality, and I think partly because of people like Dr. Ferrer and other public health experts who are out there showing graphs every week in front of the media. Here's the rate of COVID deaths if you're Black. Here's the rate of COVID deaths if you're white. And on and on and on, and really helped drill that point home. Before it was stuck in, the New England Journal of Medicine or some other journal that physicians would read, but that what didn't come into the common parlance. And I think that was incredibly valuable and hopefully can be the start of change. Just a couple of other quick things. One is more, I think, philosophical, and the other more concrete. On the philosophical side, I think what's been most striking to me is how much I've seen our society struggle with its individualistic tendencies. And I don't need to tell you, we're built on this fabric and this framework of individual self-determination and make your own choices and freedom, and what does freedom mean? And that's really the foundation of our nation in many ways. But that goes up against what is really a sense, especially that became prominent with COVID, of what does it mean to have community responsibility? What does it mean to try to work toward the health and the protection of your community? What does it mean as far as little things like vaccination? It protects you, yes, it protects you, but it protects other people. Mask wearing, yes, it protects you, but even more so, it protects other people. What does it mean when we have to make decisions collectively as a society that do benefit the individuals, but more so than that, benefit the community? And you've seen this. I mean, it's ripe in our politics every day. And I see our country and our nation and our county really struggle with what does it mean to maintain our individual freedoms, and where should and does that stop versus what does it mean to maintain community responsibility while still having individual responsibility. And I don't know where that's going to end. I think it's a long discussion that we're going to see play out over years. I find it interesting in how it intersects health. The second, much less theoretical, philosophical piece is just, especially for me in DHS, so much of what we do, so many of our programs touches on one of all three pieces of this constant cycle between the jails, mental health institutions, and homelessness. And whether we're doing, I've got nurses out on the street doing street outreach and running clinics in Skid Row and trying to get people into permanent supportive housing. Those same people are we operate the only 3 locked psychiatric emergency rooms in the county. People cycling in and out of the locked PESs and of the inpatient psych units. Those same people were booked into the IRC at Twin Towers and Men's Central Jail. We're working then to get those same people with mental illness out of jail through Office of Diversion and Reentry. And I think part of it is that has become to the forefront more with justice reform. That did start prior to COVID, no doubt, but it's been accentuated with COVID, in part because of clear data that we were able to decarcerate the jail. When COVID came, there was a population up to 17,000 in the jail, in the LA County jail system, dropped to 12,000 when COVID came because of changes in sentencing procedures and bail procedures and release procedures. Populations back up to 15,000, but the population in the jail of individuals who have a diagnosed mental illness is at an all-time high. Never been higher in the LA County jail system. And when we think about how we're treating some of the most vulnerable people, their risk of COVID, their risk of adverse health outcomes when they go back out, largely on the street or without adequate supports, without an adequate community mental health system, I think that's one of the things that to me is forefront in my mind, and I know there's a lot of energy and attention trying to break that cycle, but that's where we need to put a lot of more emphasis as well. And COVID just reinforces those same patterns because it's about poverty, it's about race, it's about opportunities, it's about some underlying foundational aspects of people's lives that need a whole lot more intervention than what we've been able to give them.
Thank you. So we've just named a lot of big challenges. And I think, in some ways we can look at every barrier or every challenge as also the opportunity that we have to address it. So I'm going to just, as we continue to be in this time of disruption and change and also deeper awareness of these issues, even across the board for sort of everyday people, what do you see as some of the biggest opportunities? Is there something that really rings out to you in how we could address any of these things, or something you'd like to see? And then I'm going to loop in the arts and how maybe we can help achieve those goals. But
Sure, I'll start just quickly. One is the power of data. I think data is so powerful, and it's getting data out there, ideally data visually, that people can see the charts, they see what it is, and you pull that out and you put it in front of people over and over and over again, and it's hard work, I will tell you. Getting good, clean, high-quality data is incredibly difficult, but it's so valuable because then you can tell the story, and the second piece is telling the story. Taking the data and then putting a person up in front of people that can talk about their experience, can talk about their story, talk about what their life used to be like, talk about what the intervention was, talk about what it is now, and using the power of people's stories to help change hearts and minds. So I think those two things together, and there's certainly an overlap with arts there that we could get to. And then the third thing is I'm a huge believer in reforming budgeting processes. And I think you have to start from scratch. that when you work with whatever has been the historical way in which money has been allocated and spent in any organization, in any government, in any household, the tendency is to just continue to do whatever you've done, because it takes work to change it. If you've always spent money, 20% of your household budget on housing, or 60% of your household budget on housing, you're going to change it, but then you're likely to change it by a few percents one way or the other, and then you pat yourself on the back and say, what a big difference you made. But that's not how you make fundamental reform. And I think until you start with zero-based budgeting, until you get rid of status quo budgeting, until you start from first principles, first priorities, what do we value? What are the best outcomes? What are the outcomes we want to achieve and the best way to get there? Then you build a budget from there. It's hard and it takes time, and certainly you're going to have to go against, there's political aspects of that, there's labor aspects of that would need to be dealt with. But we do not have a hope, in my opinion, of changing some of these structural aspects that Dr. Ferrer spoke about, or many of the other problems in criminal justice reform or others, unless we fundamentally change the way in which we spend money in this country. I personally believe there's plenty of money out there. I don't actually think we need to raise more money. That's not my opinion. I'm sure people disagree with me and happy to chat, and that's fine. I will tell you, working in government, there's plenty of money. The money is not well spent, and the money is in the wrong place. And until you try to figure out how to get it into the right place, we're not going to make a difference.
Yeah, I really agree with Christina, and I would sort of marry that with much deeper commitment and understanding to the power of our communities. That sort of debate that we've been having for 3 years about, the individual rights versus the collective rights, that history, that's a dominant culture history. And for many of us, that is not our history. I'm Puerto Rican, that's not my history. And we see that play out all the time, but we don't give any agency at all in our appropriations and in the way we organize ourselves to that collective spirit that for so many of us has been buried for decades and decades and decades, our entire history in how we come together. And so I really see this as an opportunity to think about that coming together. People ask me all the time, what does the public health department need? And what I say is the public health infrastructure is not the public health department. It is not the public health department. The public health infrastructure, the emergency response infrastructure, the let's make things right infrastructure, that's in the community. And I agree 100% with Christina, we have to fund that. You can't just say that this is important and we're going to give you a grant for 3 months to do community outreach for us because you're our trusted messengers. That's an absurd strategy. That's an absurd strategy for actually making any kind of fundamental changes and for allowing our communities to be all that they can be. And we need our communities to be enriched environments for everyone. And that will only happen when we acknowledge that the public health infrastructure, not just for COVID, for everything we do, is an investment in the community infrastructure. So there's one thing, that I think needs to get changed. So I'm sort of completely aligned with Christina. It's we have to put the money somewhere else if we really want to make any of these changes.
You heard it here. You heard it here. Get the data. Tell the story. Bring the narrative. Humanize the story. Value-based budgeting. Put the money where your values and where the need is. Invest in community. And ensure there is agency for those whose voices have been oppressed or marginalized, and build that connection. That's what I heard, and I just will tell you from my vantage point, LA County has some of the most incredible leaders in the world. I meet with people for arts and culture all over the world, and honestly, you all are some of the most incredible leaders, I think, in the entire world. Now we just got to do what they said, everybody. So I'm going to bring all of us into this conversation in terms of thinking about, because we have different folks who play different roles in the room, funders, health folks, arts folks. Let's talk a little bit about the arts. So you all are incredible leaders. You're also leading operational departments that have to do things. And you've laid out a number of challenges, but also clear-cutting paths forward. What do we want to say about how the arts could possibly support those goals? Or are there examples you've seen of just, arts that you want to lift up and share?
I can start. Folks know, and this is thanks to a lot of support from Kristin and her team. We opened a healing center at MLK on our campus there. It's part of sort of the revisioning of what our health centers could be, because we also operate health centers, and acknowledging that, the public health side of the house is about prevention and well-being, and that, our health centers had a limited menu, mostly clinical services, that wasn't responsive to the community. So we opened this healing center, and then we asked the community, what did they want here? What is a healing center? We don't have the definition of a healing center, but we know we need to heal. And this is pre-COVID. And I will say we have enormous community partnerships with this healing center. All of the initial requests were around arts programs. Every single one. Drumming, a group of Latina women wanted to come. They were making baby blankets. They had all suffered some losses, and that's how they were spending their time. But every single person, they painted a mural on the wall. I mean, the youth asked for all kinds of ways to express themselves. Studio time. So it was fascinating to us, because I'm going to be honest, in health, when people think of healing, they think of mental health. And there wasn't a single request, not one, from the community for mental health services. Yes, they wanted healing services, but healing services, and I will say the other thing that always stands out to me, healing services were going to be done collectively. Groups of people coming together to share their stories and express themselves. I mean, that was the take-home theme of what our healing center should be, and I think that's art. As some part of art. So, I think we've heard, really loud and clear across, as we've opened healing centers in other communities now, that is a marriage for us. And then Kristin knows, I'm a huge fan of making sure that people who we haven't allowed to share their stories have opportunities to share their stories. And I think that means opening wide the doors to our artists, who are brilliant about figuring out powerful ways to share their stories. And those are the stories that offer both hope for healing and hope for a more just world. So I hope that we figure out other ways to partner. I know we've partnered on a pedestrian safety project. I mean, I think there's, lots of concrete examples, but I think the spirit is what we probably need to hold on to and then embed in our partnerships with each other, so that it allows us to go in many different directions.
Thank you for sharing that. And I actually want to acknowledge, I think a couple of the folks responsible for that mural might be right here in this room. LA Commons, did you do that? Did we commission you to do that? Okay, yes, thank you.
There's so many ways, and as I alluded to before, I think we're just at the tip of the iceberg, and I would love to hear people's ideas about what we could or should be doing. But just to name a few, obviously there's always the built environment, and we are trying to help improve the built environment, whether it's through murals or gardens. We have healing gardens at a couple of our facilities, trying to just enhance the visual appeal of places, because I do think it gives people a sense of dignity and worth when they walk into a facility that is well cared for and beautiful. Ways to tell stories, and we've tried to use more video and other visual arts to help people tell their stories. Our employee engagement work, we have a few different angles on this. We have a whole initiative around employee wellness. COVID obviously has been very tough on a lot of our staff, and we're trying to help support their wellness in different ways. And a lot of it is by helping people come together, because I do think people heal in a group and heal together, and they like to tell stories. And so different ways that we can bring people together. Employee recognition events that have something with the arts always are way more popular and highly rated than ones that don't. In Black History Month, we had a few events with African dancers at some of our facilities, and people loved those. And then we had some other events where we just had boring pastries or recognition certificates. And if there wasn't some element of the arts, people kind of walk out and are like, why am I here? What did I just do? This wasn't very valuable. So lots of opportunity to help promote employee engagement and wellness. And on the healing side as well, we have a program called Helping Healers Heal, when healthcare providers or staff have been involved in really sometimes very tragic patient cases, whether it's medical errors or just very sad patient cases. We have programs largely mentorship and counseling based, but trying to also pull in an element of the arts there. A lot of our pediatric programs have elements of the arts, but I think we have pigeonholed sometimes the arts too much to the peds programs, and really need to think about how we can diversify that. Our Office of Diversion and Reentry and many of their permanent and interim supportive housing units does utilize the arts partly as an avenue of mental health, but I think it's so much more than mental health. And I know the jail, we're thinking about how we can try to start doing that as we ramp up groups in the jail as well. And then last one is on patient engagement. So this is not an area I would say that DHS has historically done really well at, and we're really trying to improve there. And I think we've come a long way, though we have a long way to go. But how do we use visual arts, pamphlets, brochures, communications, social media, all the different ways in which you communicate, and make it readable for our patients? Obviously, there's a language element, there's a literacy element of that, visually appealing so the key messages come across. I mean, you look at some of our older communications and it's like, 9-point font Times New Roman with like 1,000 words on the page, and no one's going to read that. I'm not going to read that. No one's going to read that. And so how do you translate the key messages into something that's appealing that people will respond to and learn from? But I think there's so much more, and I would love to learn from you all.
Thank you. And I'll just acknowledge earlier this morning I shared some images of some of the civic artwork that we have been citing specifically at health agencies, and many of them with the two of you. So thank you for that partnership. And I'm hearing a lot of sort of amazing things we're doing that I think actually if we make part of our sort of systemic approach, right? So take that one wellness center, but then now let's actually build that into what we always do as kind of our standard. That may be what we want to do next. And I'm so pleased and proud that we have an incredible board of supervisors who supports arts, who support equity. I'm going to ask you to is there any last brief word you want to share on just where we kind of go from here, what you hope the future holds? Not only the pandemic, there's been so much on violence and gun violence, which also we know is directly related to mental health. So any sort of final thoughts on just hopes for the future before we close?
I hope that this can be an area where there really is more of a marriage over time. And I would love to have more opportunities, whether it's this or other venues, to be able to share back and forth the ideas and what people's hopes and aspirations might be. I don't think that we have enough of those forums. I think the health people we're in the clinic, we're in the hospital, and we don't cross paths enough. And how do we get out there to start those conversations and share ideas so that we can really help build solutions that work for everyone? And then, I made my budget plea, but I think the more people that are speaking up about fundamental budget reform, the better.
And I would just sort of add to that. I think the opportunity is one of some urgency right now. We're a country that needs to heal from a lot. A history of explosive racism, police brutality. We've just here in LA County, 33,000 people have died in 2 years from COVID. So we are a nation that needs to heal. And I fear for us collectively if we don't figure out how to really think differently about the role that the arts can play, because I think healing is something the artists know better than we do. And in order for us to sort of flip the way we do this work, the healthcare world needs to do a lot more listening and learning and less talking and preaching if we're going to be part of a massive collective healing opportunity that I think is essential. Like we have to get out of the cycle of hate. We have to. But you're not going to get out of that cycle of hate if you don't heal. So I look to all of you and your partners and your organizations to help us with that. Because we're going to be very willing partners, but we're not the best position to be leaders. So that's why I say we got to step back, we got to listen more, we got to learn more, but then we got to all be together to make those kinds of changes.
Thank you for that, both direction and humility. Please join me in giving a huge, huge round of thanks to Dr. Ghaly and Dr. Ferrer. Thank you. Thank you. You guys are amazing.